Immunotherapy is an exciting new treatment approach for lung cancer. For the past year and a half, we have approved agents that can actually be administered to patients with an aim of turning on their own immune system so that can go and fight the cancer. We all recognize that when cancers develop, at some point there is a failure of the immune system to respond adequately. We now have therapies that can actually activate that immune response, thereby stopping, shrinking, or sometimes even suppressing cancer growth for long periods of time. These drugs tend to be better tolerated by patients. These drugs are administered intravenously once every 2 or 3 weeks, sometimes even once every 4 weeks. And we see tumor shrinkage. We see tumor shrinkage for the sustained length of time in many patients. And that has created a lot of excitement. In certain patients, giving immunotherapy right out of the block when they are diagnosed with advanced stage lung cancer may actually be better than using chemotherapy. So for about 1 out of 4 patients with newly diagnosed advanced stage lung cancer now, we don't go to chemotherapy, we start treatment with immunotherapy. For the other group of patients who we start with chemotherapy, when they need a next option, immunotherapy is still available and is able to improve their outcomes. So overall, the advent of immunotherapy has really changed the landscape of treatment for patients with lung cancer. And we see this just as the first step. There are a lot more exciting developments as we learn more about these drugs. There are efforts to combine immunotherapy with some of the standard agents or some new agents that are being developed, which will all, we hope, will lead us to ultimately providing long-term survival and even cures for patients with lung cancer.